Hello, and welcome to today's podcast, Invest in Quality and Documentation Today to Earn Financial Rewards Tomorrow. My name is Marci Geipe. I am a Senior Manager of Product and Content for DecisionHealth, which has been a reputable brand for delivering information for over 40 years. Today, we're going to talk about ways that agencies can improve their quality, they can get ready for medical review, prepare for value-based purchasing, and achieve OASIS and coding accuracy. And you know what else all this is going to help us do? It's going to help attract and retain top talent, which, as we know, is so vital during these times, right? Today, I'm so excited that I'll be interviewing Ashley Benson, home health expert and speaker for DecisionHealth's Home Health Quality Outcomes and Documentation Conference, which is going to take place in September in Charlotte. I'm so excited to have you here, Ashley. Ashley is a home health and hospice consultant who began her career as a field nurse. She worked her way up to regional and director roles, and Ashley has extensive knowledge in OASIS, coding, regulatory compliance, and QAPI. She's very passionate about all things home health, including compliance and process improvement, and I thank you very much for joining me today.
Thank you, Marci. It's great to be here.
Awesome. Today's format is going to be a Q&A style, so I'm going to go ahead and ask Ashley a couple questions, and she's going to offer her insights on those various topics for us. So let's go ahead and turn our attention to the first question. One of the biggest trends we are seeing in home health right now is the increase in medical review activity. In some cases, agencies are getting hit with reviews from multiple contractors at one time. And of course, the interpretations have been interpreted in various ways. This can be confusing for agencies. So Ashley, what advice do you have for managers who are trying to navigate all of this?
Yes, Marci, I agree. Medical review activity is running at a high right now, and unfortunately, I do not see an end to this increased scrutiny anytime soon. So I highly recommend that agencies familiarize themselves with different types of medical review audits, including both the pre-claim and post-claim audits. So whether it's TPE, UPIC, CERTS, RACS, or even RCD, agencies need to understand the requirements for each ADR in order to respond accurately and timely. According to Palmetto, the top reason for medical review denials for 2023 was records requested were not submitted in the required time frame. So whenever agencies receive those ADRs, the biggest errors that they can make, or the biggest error that they can make, is to not respond in a timely manner or not to submit the ADR request at all. So one key piece of advice that I do have regarding medical activity is that agencies need to start early and follow the checklist of items that are provided in the request. Also, when they're gathering all the information on that checklist to submit, they need to pay special attention to the face-to-face encounter documentation and the certification and plan of care. These are the number 2 and number 3 top denial reasons according to both CGS and Palmetto. And so with audits being the new normal, it is essential that agencies develop both processes for intake and perform internal audits of all the documentation. They need to be looking at the referral information, orders, visit notes, face-to-face, really everything to make sure that all of the requirements are met in order to mitigate those risks for potential denials.
Great. Thank you, Ashley. That was a lot of really useful information. And DecisionHealth too recognizes the challenge that agencies have been facing with medical review audits, as well as the growing importance of compliant documentation to secure accurate payments. And that was one of the reasons we devoted the pre-conference for the Home Health Quality Outcomes and Documentation Conference to this very topic. Ashley's going to be speaking at this pre-conference on September 16th, and it's kind of a really exciting format for the pre-conference where attendees will work together in person to review real patient records and to really understand the key pieces of information that are needed to fulfill the documentation requirements. So we're really looking forward to that. With that, I think we're ready to move on to our next question. With quality measures determining payments as part of nationwide value-based purchasing to the increased surveyor focus on QAPI, it's inevitable that agencies are starting to invest training dollars in quality improvement efforts. So, Ashley, what are the key areas that agencies should focus on to ensure success with value-based purchasing and to avoid survey penalties?
Thank you, Marci. Yes, it is vital for agencies to understand the importance and impact that a QAPI program can have on their success. I am very passionate about QAPI. I do believe that it is a key element for successful agencies. And so when they're looking to develop a effective and compliant QAPI program, the first thing they need to do is review the regulatory guidance to understand required elements. This is going to include obviously CMS, their state requirements, and then any accrediting bodies that they are responsible for. Next, agencies need to understand the impact for each indicator and quality measure. This is going to allow them to develop those policies and procedures that include specifics regarding their QAPI program. So they're going to be looking at their scope, their data, the activities, the performance improvement projects, and then the delegation of responsibilities. When we're looking at home health value-based purchasing, star ratings, and survey, the program scope must include health outcomes, patient safety, and quality of care. Measurable data must be also collected, trended, and analyzed to determine the effectiveness and safety of services, the quality of care provided, in order to identify any areas of improvement that are needed. Data should be collected from the OASIS, so that's going to be including all of those M items that do impact home health value-based purchasing, the star ratings, and PDGM payments. Data also should be collected looking at patient satisfaction surveys, claims-based data, so that's acute care hospitalizations and emergency department visits, and then any of those adverse events, infections, falls, complaints, all of that data should be collected, trended, and tracked over time in order to identify those areas of improvement and also those areas of excellence where an agency may be performing really well. It can be challenging, and I understand this completely, and it can be challenging for agencies to develop, implement, and evaluate, and then also maintain a QAPI program that is going to be compliant, well-organized, and effective. However, again, as I said in the beginning, a successful QAPI program can minimize risk. It's going to enhance patient experience. It can improve agency outcomes. It's going to optimize that operational efficiency across the board. It's going to support the growth for those referrals and that growing census that every agency wants. It's also going to strengthen your staff cohesion, which is so important for patient satisfaction, team unity, and culture, and then also to achieve clinical excellence. It all comes back to that QAPI program and implementing something that's going to be comprehensive and compliant over time.
Wow, QAPI really does impact a lot of aspects of the business. And one of the things at the Home Health Quality Outcomes and Documentation Conference is that agencies will get an opportunity to get some useful tips for improving in some of those same areas that you mentioned, and to really, get some advice about how to establish and maintain an effective QAPI program. Attendees will even hear from an agency that used machine learning to reduce hospitalizations as one example. That brings us to our last question. OASIS and coding accuracy are key building blocks needed to receive correct home health payments, both PDGM and value-based purchasing bonuses. It's also key to minimize medical review risks and ensure the outcomes are reflecting patient improvement under your care. One of the challenges is that the rules and regulations keep changing. So, how do agencies make sure that clinicians are up to date on all of this?
Oh, that's a great question. With their focus on patient care, and that's where we want their focus to be, right? It can be difficult to keep clinicians updated of the constantly changing OASIS and coding guidance. However, keeping those clinicians informed is essential to an agency's success. OASIS and coding not only is going to play a key role in determining your payments, but scoring and coding accuracy also leads to more individualized and effective treatment plans that is going to increase that patient safety safety, reduce those adverse events, and then also improve the outcomes. So it is the responsibility of each agency administrator to ensure that their QA team, their clinical managers, their clinicians, and coders receive updated information, training, and support during these changes. And if you're in home health long enough, you know that changes is ever occurring. It's always something that we're going to have to deal with, and finding a good way to communicate that to your team is going to be essential. So one area that I think is worth focusing training on right now is going to be the accuracy of those OASIS-GG items. These items capture various aspects of the patient's functionality, and they're going to factor into those home health value-based purchasing bonuses and penalties starting in 2025. So these items were just added just before OASIS-E, and many clinicians, is what we found out, they're still not clear on how to answer or score some of those items, and determining the distinctions between the rules for answering these items compared to those functional M items that have been on the OASIS. So I highly recommend that is where they would focus on any kind of training right now, is those GG items.
Great. Yeah, that's really helpful to have, some direction and to be able to prioritize, because sometimes it can be difficult to know where to start. And based on a tip from Ashley and some of the other experts that we consulted with, DecisionHealth included a session about those same OASIS GG items at the Home Health Quality Outcomes and Documentation Conference. So this conference also has other sessions that, really help clinicians, quality managers, clinical supervisors get up to speed on some of the CMS Q&As, guidance changes from the coding clinic, etc. So thank you very much, Ashley. That was my last question. I
Thank
hope
you,
that,
Marci.
yeah, it was great having you today. I really hope that this podcast reinforces the need for agencies to invest in some of these quality efforts that will not only impact patient safety and care, but also financials. So once again, thanks, Ashley, for all of your thoughtful answers and your insight about all of this. We are excited to have you part of the Home Health Quality Outcomes and Documentation Conference in September. As a thank you for those listening, we are going to offer a $75 discount on top of our early bird discounted rate. So please visit the URL that's listed on the screen to learn more about the conference. And when registering, please use promo code QUALITY75. You can learn more about the conference at decisionhealth.com/QOD as in David 2024. Again, decisionhealth.com/QOD 2024. Thanks a lot. Thanks again to you, Ashley, and I hope everyone has a wonderful day.